Hello everyone, welcome to video series on disease and therapy. I am Ahalya. Today we will discuss about hydrocephalus. So what is hydrocephalus? It is a medical term for a condition that is commonly called as a water in the brain. So in this one, water, it's not a water, it's a cerebrospinal fluid. Cerebrospinal fluid, it looks like a water, but it contains electrolytes, proteins, nutrients to keep our brain healthy. Main purpose of cerebrospinal fluid is to cushion our brain and spinal cord against injury. The mostly one pint of cerebrospinal fluid is produced by our brain. So coming to hydrocephalus types, these are mainly two types. One is obstructive and second one is non-obstructive. And first one obstructive is a obstruction within the ventricular system of cerebrospinal fluid to communicating or prevent the communicating or flowing of the cerebrospinal fluid within the brain. Second one is non-obstructive or communicating. This type results from problems with the production or absorption of a cerebrospinal fluid. The most common is caused by bleeding into the subarachnoid space into the brain. Okay, so why does hydrocephalus occurs? Main causes are lesions, malformation of the posterior fossa, Dandy-Walker syndrome, tumors, intrauterine infections, intraventricular hemorrhage, Kyrie formation, Dandy-Walker syndrome. These are some common causes of hydrocephalus. So coming to a diagnosis, history and physical examination. In history, familial cases, past history, neurofibroblastoma. Physical examination, inspection, palpitation, oscillation. Tapping with the fingertips on the skull may show abnormal sounds associated with the separation of skull bones. Scalp veins may appear dilated. Eyes are depressed. And coming to symptoms, these are irritability, poor feeding, lethargy, vomiting in infants. In older patients, changes in behavior, headache, academic deterioration. These are common in older patients. Mainly symptoms are two types, early symptoms and late symptoms. In early symptoms, enlargement of the head, bulging of fontanelles, sutures are separated, vomiting. Late symptoms are decreased mental function, delayed movements, difficulty feeding, excessive sleepiness, brief, shrill, high-pitched cry, slow growth up to 0 to 5 years. So therapy, medical therapy is acetazolamide and furosemide. Surgical therapy is VP shunt placement. VP shunt is a ventricular peritoneal shunt. The shunt is most commonly used. It is a simpler to place. Extra tubing may be placed in the peritoneum and the consequences of infections are less. That's it. Thank you.